Virginia. Ms. McClellan for 5 minutes.
Thank you, Mr. Chairman. Thank you, General Milley and Secretary Austin. And Secretary Austin, I want to follow up. First of all, I appreciate your commitment to meeting the comprehensive healthcare needs of all our servicemen and women. And I want to follow up on the line of question from Mr. Davis around mental health and suicide. And I agree with you, mental health in the military has been a constant struggle. And while we've seen some improvement, the suicide rate remains nearly 60% higher than the civilian suicide rate. Can you tell us specifically how the DoD is mobilizing resources within the budget to address mental health needs and bring this number down?
Yeah, so we're asking for $1.2 billion, excuse me, we're asking for $1.2 billion for support for suicide prevention. Excuse me, $209 million, I'm sorry. $209 million for suicide prevention. As you know, we stood up a commission to focus on this. They provided recommendations back to us. We've already taken some of those recommendations and put them into action. And we'll continue to work on the other recommendations to make sure that we have processes and procedures in place in order to be able to implement them.
So one of the ways that we can make sure we are addressing the mental health needs of our service members is helping to ensure that there are sufficient providers that can provide that care and that they are reimbursed for providing that care so that they stay incentivized to provide it. But currently, the reimbursement rate for mental health under TRICARE is dramatically lower than that of other comparable government health care programs. Does DoD have the resources to increase the rate of reimbursement, or is that something that you need us in Congress to take action on to raise those rates and help increase the number of mental health professionals who are willing to take TRICARE?
Right. We certainly need all the help that we can get in that regard. I've asked the DHA to really focus on this specific piece of access to mental health care and do everything that we can to improve in this area. So.
And thank you. And related, a study published by the Journal of American Medical Association in January showed that 35% of TRICARE beneficiaries lived in an area with a shortage of mental health providers, civilian or military, and that approximately 6% of TRICARE beneficiaries lived in an area where there was no mental health provider at all, within a 30-mile driving distance. What is the DoD doing to ensure that TRICARE beneficiaries also have access to a mental health care option through telehealth?
Yeah, telehealth is something that we've been promoting quite a bit. And again, as we continue to use that, we want to make sure that the right mechanisms are in place to ensure that our families, our troops are getting the quality care that they need. I think that's really important.
And are there any resources or legislation that we should be pursuing to help you to ensure more access to mental health care, either through TRICARE or any other mechanism that is not currently included in your budget request?
There's nothing I need to ask you for at this point in time, but if there is, I'll come back and ask again. So.
Okay, thank you. And then finally, has DoD done a full accounting of how TRICARE's mental health coverage and resources can better support our service members?
I think we've done a very thorough scrub of this throughout. This continues to be a work in progress. I'll take for the record that question and come back and give you a specific answer.
Thank you very much. I yield back.
I thank the gentlelady chair, and I recognize the gentleman.